Dodds. Jean, hello.
Hi.
We're in Venice still, and we're going to talk about Titer tests. I don't know a lot about it, and I wonder if you could fill me in. As far as I know, you can have a test done that's quite a simple test that tell you if your dog doesn't need to have a vaccination or a booster, I suppose, again. Can you tell me a bit about the tests, how they work? Because I don't really understand it.
Titer tests are measurements made in serum, the liquid portion of the blood from an animal that has been vaccinated, or it could be a rescue and you don't know.
Okay, yeah.
An adult rescue, and you want to see, have they ever been vaccinated before, rather than just giving them a jab, okay? Yeah. It's very important that you not depend upon titers if it's a puppy or a kitten until they're a certain age, because they still have maternal immunity that they've got from their mothers if they suckled, you know, if they weren't an orphan.
Yeah.
That can last as long as 14 to 16 weeks.
Yeah, that's what I've been told, 14, 16 weeks.
So you wouldn't do a titer before, say, 16 weeks if the animal had not been vaccinated recently.
Right.
And a lot of people say, well, I don't want to over-vaccinate my pet, so I'm just going to do a titer at 12 weeks. Well, you can't do that.
Right.
Because if you're measuring the mother's residual immunity, it'll be gone in a couple of weeks and the animal will be susceptible. So you either complete a proper, safe puppy series or kitten series, maybe 2 or 3 doses maximum, and you don't have to do a titer right away then.
Yeah.
If the animal's either going to be immune, or it's going to be a genetic non-responder or a poor responder, in which case it's going to be like that for the rest of its life. It's never going to respond. Genetic poor responder to a vaccination or a low responder to a vaccination.
Is there some pets that just can't be vaccinated?
Right. They can, or they won't be ever protected.
They'll just never be protected.
Right.
Oh, okay.
And there's certain breeds that are more likely to have that. It's rare. The risk is about 1 in 1,000 for canine parvovirus, which is actually not that rare.
Yeah.
1 in 5,000 for canine distemper virus.
Okay.
Those animals will be susceptible for life, and giving them more vaccines will do nothing.
So it's not going to protect them?
No.
So no point.
You need to know, if you're breeding animals, for example, that they actually were responsive to the vaccination series. So you wait until they're 8 or 9 or 10 months old before you breed them to select them for breeding.
Yeah.
And you do the titer test.
Yeah.
And you measure the serum immunity. And if it measures anything, I don't care how high it is, you know they're a responder.
Yeah.
They're not a genetic non-responder. That's really important.
Yeah.
So then, let's say it measures, but it's low-ish, and the person is twitchy about that. So then you give 1 more booster, that's all. And then you wait.
And then you wait.
Typically, you do a booster, say, between a year and a year and a half, the titer, sorry, between a year and a year and a half. And then you can do it every 3 years after that.
So every 3, because there seems to be a lot of controversy about this, which, you know, some vets are saying every year. Some are saying every 3 years, and then I've heard other people say, oh, you can do it in 7 years' time. So you recommend every 3 years? Right.
The 3 years is based on national and international standards. The World Small Animal Veterinary Association, the Australian Veterinary Medical Association,
so
the
Just
American.
somebody's made it up.
No. They've shown 3 years, because that's what the law requires for rabies boosters, for example. So 3 years is fine. Now, some people may feel they want to measure 2 titers before they go to every 3 years. 1 at a year, and 1 at 2 years, and then every 3 years. That's fine. Immunity can be for life. I mean, people can say, well, once you've vaccinated the animal, you never have to give it another booster. But not every animal's the same.
Yeah.
So you can't say, well, it may be good for your animal, but not for the next one.
Yeah.
So a general rule of thumb would be every 3 years until they're 10. And in our clinic, we won't do a titer anymore. If they want to pay us anyway, we'll measure it.
But after
we're not going to vaccinate them anyway.
No, exactly.
So forget it.
So after the age of 8, should they really not have a booster?
They don't need it. Right.
They don't need it. Okay. And so after 10, there's no
forget
point.
it.
Just absolutely no point. So we recommend. And how does the test work? What do you actually have to do? Do you have to draw blood?
You draw blood, and the serum liquid portion is separated and is sent to the laboratory, and then the titer test is done. And there are many, many different places that do it these days, and there are different methods.
Yeah, there is actually. You can find there's loads of places
but
now,
some of the results say that the level should be at least this. That's not correct.
How do we find that out?
Well, it'll tell you. It comes with a printout that says blah-de-blah-de-blah.
Okay. Yeah.
Any measurable titer by that method, if it's validated method, means you've got immune memory. Okay. Doesn't have to be 10 times pregnant is not any more pregnant. Okay?
Okay, yeah.
Okay?
Yeah, that makes sense. Yeah,
Right.
Okay. So when you get your titer back, I've had a few people say to me that the vets haven't been able to read maybe the titer test properly, and that's caused a bit of an issue, and then they've been given the booster anyway. Are vets in veterinary schools these days taught how to use?
Not really. It depends on what school they go to.
Oh, it does.
If they went to a veterinary college where there's an immunology course that's clinical applied immunology, they would learn.
Yeah.
Like in Texas or in Wisconsin, for example,
Yeah.
or of course where we are.
Yeah.
Many people don't. But some of the titer tests that are done, the actual report is totally confusing.
Yeah.
So the result will come back, say, canine parvovirus, and it'll be 1 to 18 or 16 or whatever. But below that will say, the titer might mean this, it might blah, 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 and the people are totally confused.
Yeah.
And then it may say canine distemper virus 1 to 80, and they say, oh, well, that's much better. So
Yeah.
obviously parvo is not good enough.
Yeah.
Because they don't understand that any measurable amount is okay, and each virus has its own optimum level.
Yeah.
So it's not going to be the same.
Yeah. So the best thing to do is to have a titer done every 3 years, and you don't have to respond, because I know a lot of people feel pressure when they get that letter through the post and it says, it's time for your dog's booster, and they feel a bit of a panic. So they can go into their vets, and I think a really good important thing to know as well is they don't. A lot of people have said to me, I haven't got a homeopathic vet near me. It can be any vet. It's a catalogue. You look it up and you find where you can get
Right, we would just say, I've come in for my annual checkup and I don't want a booster vaccination.
Until I know
want a blood test instead.
Yeah.
So they just say, and they'll pay for it, and the veterinarian's going to make more money on titers than the vaccine.
Yeah.
So they should be happy, and if they're not, exit left.
Yeah. As far as I'm concerned, if you're not over vaccinating your dog, then you're not going to have any health problems, and you're going to be going to
Very
the vet
few.
anyway. Yeah.
You're going to feed them properly, and then you're not going to see the veterinarian.
Because we like that.
Oh.
Yeah. All right. Thank you, Jean.
Okay.